Breaking update which is coming in, and the Karnataka Chief Minister is going to chair an emergency meet on Omicron today. This, of course, remember, both the Omicron cases in the country have so far been reported from Karnataka, and the Karnataka government is, of course, going to formulate a strategy on Omicron after meeting health experts in this meeting.
ನಾವು ನಿಯಂತ್ರಣ ಮಾಡಬೇಕು, ಇದನ್ನು ಹೆಂಗೆ ತಡೆಗಟ್ಟಬೇಕು ಅನ್ನುವಂಥರ ಬಗ್ಗೆ ನಮ್ಮ ಸ್ಟ್ರಾಟಜಿ ಏನಿರಬೇಕು, ನಮ್ಮ ಇದರ ಬಗ್ಗೆ ಕ್ರಮಗಳೇನಿರಬೇಕು ಅನ್ನುವಂಥರ ಬಗ್ಗೆ ಸಂಪೂರ್ಣವಾಗಿ ನಾಳೆ ತುರ್ತು ಸಭೆಯನ್ನು ಕರೆದಿದ್ದೇನೆ. ಅಲ್ಲಿ ಸಂಪೂರ್ಣವಾಗಿ ವಿವರವಾಗಿ ಮಾತನಾಡಿ ಒಂದು ಹೊಸ ಮಾರ್ಗಸೂಚಿಗಳನ್ನು ನಾವು ಕೊಡುವಂಥ ಅವಶ್ಯಕತೆ ಇದೆ ಅಂತ ನನಗೆ ಅನ್ನಿಸ್ತಾ ಇದೆ.
Let me go across to my colleague Neha Hebale, who's tracking all these updates. Neha, so 2 cases in Karnataka. Clearly, this is, of course, not just about Karnataka. There are strategies being formulated by states across the country. But the fact that these 2 cases have been detected in the state, so there's an emergency meet now in which most likely fresh guidelines might come out of this meeting.
Absolutely right, Tanima. The Karnataka Chief Minister over there, while commenting on the 2 new Omicron cases, not really shying away to say that the government will consider issuing new guidelines. And let's remind you that, now we're seeing how he's called for an emergency meeting with all the health department officials and members of the Technical Advisory Committee and experts also. It's going to be a very crucial meeting, likely that they are going to implement the guidelines now that were suggested by the Technical Advisory Committee, and most likely, Tanima, measures are going to get more stringent over here. Let's remind you that it's not only the 2 cases of Omicron that were reported over here, but in fact there are 5 more primary and secondary contacts of one of the cases over here right now. The samples have been sent for genomic sequencing, but for now, to be on the safe side, the government is proceeding, assuming that these could also be Omicron, and they've started to, actually trace out all the primary, all the secondary contacts. They started to get them tested as well. But one point of concern that still remains over here, Tanima, is that this person who tested positive happens to be a doctor, we understand, and he had no travel history whatsoever, and unlikely that he possibly met somebody who came from another country. That is what is being looked at right now. The source of the infection, it is going to be crucial to identify. That is what the government has said.
Right, Neha Hebale, they're tracking all these updates. We'll, of course, be taking updates on the meeting with you as well. Thank you so much.